My name is Blake Smith. I'm a Genesis physician assistant. I work in orthopedics. I've been here since 2018 and I've been a physician assistant since 2014. So the route I took as to become a physician assistant is I got my bachelor's in chemistry from College of Worcester, and then I went to PA school, which is a master's program. Physician assistant school is approximately 27 to 28 months for an education to obtain your master's. The first year is typically your didactic phase, where you're in class from 7 to 5 p.m. learning all different types of medicine, your microbiology and classes like that. Then after that, you have your clinical rotations, which is about another year. Mine were 4 weeks at different institutions where I had general surgery rotations, family practice, orthopedics. After that, you're able to take your certifying exam once you graduate from PA school. Once you take that, then you get your certificate to practice, and you're a certified physician assistant. Physician assistants are all over the place in medicine. They're not really limited by what specialty they can practice in. That's one of the big draws for individuals to become a physician assistant is the laterality of movement. If I wanted to, I could go work in plastic surgery if I wanted to, or general surgery, things like that. So you'll find one of us typically in a lot of surgical specialties as well as family practice. My day-to-day as an orthopedic physician assistant depends on what day it is. One day we'll be in clinic all day, seeing new patients, follow-ups, as well as our post-op patients. The next day, maybe in surgery all day, doing total hips and total knees. The next day could be a little bit of both. We'll see our follow-up patients from the previous day's surgery, as well as have some clinic in the afternoon. But that's what kind of drew me to orthopedics, was the combination of both the surgery side as well as the clinic side, where I'm seeing these patients and I get to follow them along in the recovery process. So one big difference with physician assistants compared to nurse practitioners, we are dependent practitioners. We have a supervisory physician who overlooks what we do. How much supervision depends on how experienced you are. I've been in orthopedics since 2014. My relationship with my surgeon, Dr. Jackson, right now is very independent, meaning I see my own patients, and once they're ready for surgery, if they require it, I get him involved because he's the surgeon. But I still talk to the patient about surgery, make sure they understand these things, and then I say, well, you're in good hands with Dr. Jackson, and I'll be right there by your side through the recovery process. What I really enjoy about orthopedics is helping patients and seeing their progress through a healing phase, whether if it requires surgery or whether it doesn't require surgery. I think it's a fascinating process, and I think it's great to get to know the patient through the process and seeing how they progress through it.